Turn our attention now to the latest coronavirus case numbers in Montana. We're now over 72,000 total confirmed cases. More than 10,000 of those are active. 831 Montanans have died as a result of complications with the virus, including 9 new deaths in Cascade County, which has 91 total COVID-19 related deaths. Cascade County also shows over 5,800 total cases and almost 1,400 active cases. Lewis and Clark County has almost 3,800 total cases, just over 950 active cases there. Now remember, we use numbers from local county health departments and state figures to deliver the most accurate case count each day, because local county health departments may be alerted to cases before Montana Department of Public Health and Human Services is. With the COVID-19 vaccine potentially just days away from distribution here in the U.S., there are growing concerns that getting the vaccine to people may not be a smooth process. As Maya Rodriguez tells us, some say a more national approach may be needed.
Federal officials say the key component to getting the COVID-19 vaccine distributed across the country will lie in the hands of states, with help from major pharmacy chains like CVS and Walgreens.
We want to replicate the experience you have for the flu vaccine. We want it convenient to you. Use a tried and true system that we do hundreds of millions of vaccines through every year. So that's really the backbone of the approach that we're taking.
But if flu vaccine rates are any indication, that backbone may not suffice. Dr. Eric Schneider is with the Commonwealth Fund, an independent organization that studies health policy. They recently delved into previous vaccination rates to see how it might unfold for COVID-19.
Our healthcare system does well at developing new technologies like these vaccines. We don't do as well at making sure those technologies are distributed to the people who need them most. And we're seeing that in the prior vaccination experience.
What did they find? A mere 51% of Americans got the flu vaccine last year, and only 38% of people got the H1N1 swine flu vaccine 10 years ago, which had a similar vaccine development timetable and pressure, much like COVID-19. Those low vaccination rates matter because in order for the COVID-19 vaccine to create herd immunity in the U.S., between 70 to 90% of all Americans will need to get vaccinated.
The concept of herd immunity really develops out of vaccination programs, because the question is what proportion of the population needs to be vaccinated to prevent the circulation of a virus in the population.
And just getting that shot could vary depending on where you live, as the federal government is leaving that up to each state.
That's going to be up to the nation's governors as they prioritize within their state.
But Dr. Schneider says in order for the states to pull it off, they're going to need federal help.
Congress is considering a federal rescue package. That funding is really necessary to get states the support they need to vaccinate large numbers of people.
Large numbers of people now waiting for a rescue of their own from a virus that's changed everything. In Washington, I'm Maya Rodriguez.
Remember, the 2 facilities in Great Falls that will receive allocations of the vaccine at first are Benefis Health System and the Great Falls Clinic. We spoke with Benefis earlier this week, and now the clinic says they have similar concerns. Infection preventionist Heidi Leppert tells us they're still waiting to learn exactly when the vaccines are coming and how many the clinic will get. An FDA advisory committee did recommend emergency use authorization for the Pfizer COVID-19 vaccine yesterday, but that authorization must still be approved by FDA officials. Heidi added that the clinic will be ready to vaccinate whenever they receive the vaccine.